How do various human factors influence the interactions between medical personnel, and how do these interactions affect patient outcome? By Eoin, Georgie, Ollie and Tia.
In this presentation, we will critically discuss and analyse how communication, gender, teamwork and leadership affect patient satisfaction, and how this could relate to the number of complaints received by the LAS, such as outlined in the module case study.
One of the main functions of communication is to deliver a message. However, it is important to consider that communication is not just verbal in form and is much more than the words we say. A 1971 study by Albert Mehrabian states that 93% of communication is affected by body language, attitude and tone, leaving only 7% of the meaning and intent based on the actual words said. However, Phil Yaffe thinks the 7% rule is a myth. He disagrees with the notion that in an oral presentation, what you say is considerably less important than how you say it. He believes the myth arises from misinterpretation of a scientific experiment and needs to be put to rest for the sake of scientific integrity. In paramedic practice, information is rarely delivered face-to-face. From electronic dispatch to over-the-phone GP referrals, most patient information is delivered without any human contact. Although this type of communication is quicker, more efficient, and arguably easier, it is questionable, therefore, whether 93% of patient information is lost, posing a potential risk to not only the patient, but the clinician also. Lack of communication creates situations where medical errors can occur. These errors have the potential to cause severe injury or unexpected patient death. Medical errors, especially those caused by failure to communicate, are a persistent problem in healthcare today. A 2010 study by Zimmer et al. Of German paramedics completing simulated medical scenarios showed that 100% of the handovers between paramedics and emergency physicians were incomplete. This suggests that miscommunication occurs not only in theatres, in referrals and in prescribing, but instead begins very early on at the handover stage. However, this study was carried out in Germany, and although predominantly the same process of patient care occurs, in the UK handover is very standardised and there is a specific algorithm that paramedics follow to avoid any error in this critical stage. Furthermore, Germany has a significantly higher uncertainty avoidance index than the UK. Uncertainty avoidance index describes how well a country can deal with the fact that the future can never be known. The UK represents a nation that is happy to make it up as they go along and change plans as new information arises. It shows the British are comfortable in ambiguous situations and there are not too many rules in society, resulting in a clear end goal and a fluid process to get there. At first glance, this appears to be a valuable quality in the workplace. However, it could also be argued that a high uncertainty avoidance index, representing more rules, deductive thinking, and relying strongly on expertise, is preferable to potential ambiguity related to the uncertain future.
Another factor that greatly influences hierarchy is gender. Women make up 77% of the NHS workforce, whereas only 37% of senior roles are held by women. This gender inequality in senior roles implies a lack of support for women in managerial roles or roles superior to those of their male co-workers. In a field where hierarchy is common, one would expect more male employees viewed as being more senior within these hierarchies. In the case study, the team leader is male, whereas the second crew to arrive are both female. As described, during a disagreement, the male paramedic insists that he is the senior clinician, which intentionally or unintentionally creates a hierarchy within this clinical setting. We know from the complaint letter it is the female paramedic that noticed the relative was angry and frustrated, although complied with the male paramedic's instructions. According to a study published in the American Journal of Psychiatry, women show more empathy towards patients. Although this study was carried out on physicians and not pre-hospital staff, this may be why the female paramedic was more aware of the relative's dissatisfaction. As the male paramedic has created this hierarchy, it is now less likely for the female paramedic to challenge the instructions given to her and to address her concerns about the relative's frustration. In a hierarchical environment, often dominated by males in senior roles, female employees will be challenged more frequently and have their input listened to less. Hierarchy within a clinical setting is a massive issue, and a consequence of this may be furthering gender inequality within the clinical environment.
It is widely recognised that effective teamwork is paramount to successful patient outcome. An effective team can be defined as one where each individual, patient included, communicates effectively and acknowledges all relevant information given to provide the best patient outcome. The NHS in England deals with over 1 million patients every 36 hours, meaning our resources can only stretch so far. However, in 2002, Mayor states, "We cannot simply blame the lack of resources for all the failures, although it often plays a part, Poor communication between departments and lack of integrated team working are also enormous problems. This stretch in resources cannot be held responsible for the failure of quality of patient care, as paramedics should be capable of working effectively as a team regardless of GP availability. The NHS currently operates under a system of silo working. This is where individual departments lack teamwork and do not communicate effectively, which in turn can cause failures. This can be seen in the case of Baby P, where each different faculty was under the impression that an alternative department was responsible for safeguarding. As a result, no department raised their concerns for the welfare of Baby P, which consequently caused the death of a 17-month-old child. Improving teamwork throughout the NHS could therefore prevent these tragedies from occurring. This is further demonstrated in a 2014 study by Babaker et al., which states that no single practitioner can handle, absorb, and use the plethora of information provided for each individual patient, and that different team members with specific areas of knowledge are required to provide optimal patient care. To improve patient outcomes, morbidity and mortality conferences in hospitals have been implemented to review errors that occur within patient treatment. Currently, in the UK, there is no pre-hospital equivalent. Meetings to discuss errors made within a team, specifically when a complaint is filed, could perhaps benefit patient outcome. A 2002 study by Orlando et al. Outlines the benefits and disadvantages of morbidity and mortality conferences and states that they can be extremely beneficial in attempting to learn from error. St. Charles County Ambulance District in Missouri has implemented a similar system of peer reviews in which employees examine their peers to ensure the appropriate standards of care are met. Although this system is effective in the US, the similar nature in which ambulance services operate worldwide means that perhaps implementing a similar system in the LAS could ensure better standards of care are met.
Leadership within the NHS is an ever-changing role description, with the characteristics of an effective leader constantly being re-evaluated. A 2009 study by the NHS Ambulance Chief Executive Group suggests that improving leadership within the LAS could help reduce the number of complaints, such as the one seen in the module case study. The benefits and disadvantages of leadership in emergency situations has been reviewed in a study about the 2005 London tube bombings. The study by Strom and Eoin found that leadership is crucial in developing cross-agency systems in an emergency. Although this applies to leadership strategies amongst various interagency faculties, for example the ambulance service, the police and the fire brigade, and not specifically within pre-hospital care, the same findings can be applied to the intra-agency faculties within the LAS as they operate under the same system of silo working. As previously mentioned, silo working is a mentality in which various departments do not share information with other departments of the same organisation. Currently within the LAS, leadership is prevalent within individual faculties, or silos. However, perhaps what is lacking is someone to overlook the full process from call connect to patient transfer and everything in between. This leader would be able to relay important information between the individual departments involved, such as the call centre, NHS 111, paramedics and others, to ensure the needs of the patient are met. Having said that, leadership roles are often unattractive to employees, as there is a culture of blaming leaders for specific job failures. It is therefore important to recognise that failure within the NHS arises as a result of system-wide causes, rather than the direct actions of individual leaders, as found by Anand de Silva et al. In a 2018 study. Although theoretically this concept could aid the problem of silo working prevalent throughout the LAS, the vast number of calls responded to at any one time makes this proposal unattainable, as there would not be enough resources to oversee the full duration of each call. However, the benefits of leadership are already becoming more apparent within LAS practice. The pit-stop CPR system has recently been introduced as a model approach to CPR. It suggests that clinicians should perform CPR with an individual, usually a team leader, overseeing the whole procedure. Theoretically, this would improve patient outcome and therefore reduce the number of complaints received by the LAS each year. In conclusion, we have found that the number of interactions between medical personnel are significantly influenced by a number of factors. As established in our research, good communication skills, equalised gender roles, improved teamwork, and a defined leadership role have all been found to have a positive effect on patient outcome, which could in turn reduce the number of complaints received by the LAS, such as the one outlined in the module case study.